We welcome you all to Talk the Talk. My name is Janine Stiene.
And I'm Toni-Ann Antoniato,
the Masters of Myofunctional Therapy.
Together, we interview physicians, dentists, and other professionals to learn how their expertise can benefit you, your child, or your patient's speech and language skills and complement the services they are receiving. We welcome Tricia Rogers to this episode of Talk the Talk. Tricia is a speech-language pathologist specializing in orofacial myofunctional therapy, as well as the author of a playful and engaging series of books called Miss Tongue and Friends. Tricia has been treating and diagnosing patients with orofacial myofunctional disorders for the past 20 years at her private clinic. With over 3 decades of experience, Tricia is deeply committed to building relationships and collaborating with other professionals in the world of healthcare to help her clients reach their goals. Tricia's books were designed to be a myofunctional tool, which helps children and their parents understand the importance of proper oral function while also helping build healthy and proper oral habits. Thank you, Tricia, for being on this episode of Talk the Talk. We are so excited to have you.
Thank you so much.
Thank you so much for being here. Yes.
Yes. Thank you so much for having me. I'm so excited to be with y'all.
Yes.
Thank you. We feel the same. Absolutely feel the same. And we're gonna just rip the Band-Aid off and start right from the point of when, as a practitioner, did you feel this need was present for you to write these books or to introduce these books to the clinical side, but the patient side as well?
Right. Oh, so it was, I would say about 10 years ago, maybe. I was working with a kiddo and it was struggle. And oftentimes I knew a lot of my referrals were coming from the orthodontist. And of course, they were older children at that time, not the younger children. And in a private practice, as y'all know too, you see the children and then you see the siblings of the children. And so it was, coming to my attention and that we need to get to these kiddos earlier, right? And cognitively, they cannot understand or follow the myofunctional programs and all the concepts that we're trying to teach them. So I was like, okay, what can I do? And I just started with one kiddo one time that was a chaotic, terrible going session. And I was like, wait a second. It's like, you know what? Your tongue is so tired. Did you know that? And he's like, what? It is? I was like, is your tongue tired? Yeah. Do you know what? Your tongue needs to rest. And and he was like, yeah. And I was like, can you put your tongue on her pillow? And he was like, and I showed him exactly where the pillow was. And he was like, okay. And he was like thinking, and he did that. And literally the entire session changed. Like, it was like, just, okay, yes. And so then we talked about and honest to goodness, at the time it was Mr. Tongue. Okay. Because it was I was working with a little boy. I was like, you're Mr. Tongue, right? So I was like, we did that. And so they went home. The mom was a nurse and very involved and knew breathing and was like, okay, we need to fix this. And said, where's your Mr. Tongue? Where's your Mr. Tongue? All throughout that week. And she came back and was like, Tricia, this was amazing. We talked about Mr. Tongue being on his pillow. And I'm like, So then I started testing it out with other clients. And we would draw it out. We would talk about it. It would just be a thing, Mr. Tongue resting on the pillow. Well, moving further along with that, it was pretty obvious to me that Mr. Tongue, it wasn't just about the tongue, as we know, right? It's just not just about the tongue. And so I brought in the nose and I brought in the lips. And so I was like, okay, so we have Miss Tongue, we have Mr. Nose, and we have the lips. And so everybody has their own designation of like who they are.
Okay.
So that's how that turned out. And it just, and I had an orthodontist who was sending me all these patients, and he was like, Tricia, we got to get to the kids earlier. We got to get to the kids earlier. I'm like, okay, but you're sending me so many patients, I don't have time to figure out how to get to them earlier.
Right.
So this
Wow.
started the whole process.
Okay. Okay. And how long of a journey has this been?
So yes, so
I can tell by your face. It was definitely, we appreciate that. It's very
yes, it's embarrassingly long. So I finally, during the pandemic, right, when I went to online and people were doing that, and I was like, I really need to focus on this. I really need to. And I was also asked to do some teaching in the early intervention group in our county here. And so I was working on that at the same time. And it was just a good way to explain it to SLPs that did not understand about rest posture and the lips. And so I just incorporated it after I had tested it out a ton in my practice. So then I had to hire an illustrator.
Okay.
right.
Wow.
And I found her on Instagram, and she was a grad student at the time,
Wow.
as an SLP grad student.
Oh, that's perfect.
Yeah.
Yes. And so then it just evolved, and it took me 5 years.
Wow.
Wow.
Okay.
Yes. That being said, a lot of life events were happening, learning the technology of how to do, that was the kicker too. But and then just perfecting it to it being ready for the world. And I think y'all know, as when you teach, when you're in therapy, you can fix it, you can explain it again and again, and you can and then when you teach, you have an ability to do that.
Right.
But when you write,
Yeah.
one
time.
chance.
Yeah.
It's very
One chance to get your point across.
Yeah.
Wow.
Wow. And then I'm assuming you had to find a publisher and a print, like someone to print it.
Yes. So I ended up self-publishing it at this point.
Okay.
Because, and yes, finding a printer and then setting up and doing all the research, like what size do I do it in? What age group am I trying to, I'm trying to, so the whole process was quite amazing. Like I just never expected that this was gonna be what I was doing.
Yeah. And then you think back, like, how did I do that? Like, how did I manage all that in that time frame,
Right.
Right. And you were still treating in your clinic. Okay.
Yes.
Okay.
Absolutely.
Yeah.
Absolutely.
Wow.
And yes.
Okay. And now did you release, so we have the 3 books that you talked about, right? So we have The Lips, Learn to Stay Together, Mr. Nose
Right.
to Breathe, Miss Tongue Learns to Rest. Did you release all of these at the same time? Did you do some before the other?
So so I released all of these at the same time.
Okay.
I wrote this one first.
Okay.
And then it was just, I think I wrote Mr. Nose next. And then The Lips Stay Together was the last one, because I was toying around with how much I was going to personify the lips. Because I was like, Tommy Top Lip and Bonnie Bottom Lip. Am I going to do that? Or am I just going to stick with the lips? And because I have other ideas within the series that are in the works, I just kept it with the lips, because it's also the vocabulary that we want to, the concept of vocabulary. So I just kept it like that, instead of trying to make it as cute. But there is one more that's in printed form.
Oh, we don't have that one.
Yes, I know. It's been newly released.
Oh, okay, good.
So so there's that. And then there's another one on as an ebook.
Okay.
That is only ebook at this point, and it's Miss Tongue's Resting Adventures.
Okay.
And that one's just, and it's kind of like Miss Tongue rests, when all the types and places that she rests, so that the kids can start to incorporate it in their lives.
Okay. Okay.
I love that.
Very cute.
What are, do you have a lot of myofunctional therapists in your area? or I heard you say earlier that you're getting so many referrals, you don't have enough time. Is there another group of individuals that you can refer to?
That's so much time and referrals was because I was the only, that was when I was the only one.
Okay.
Like I was just doing a consult the other day in a school district in Vancouver, and she said to me, she goes, "Oh, you were doing Myo before it was cool." And I said, I was actually doing it when it was not cool.
Yes,
Right? And when it
exactly.
was not cool
Yeah,
is
when
when I started it.
everyone was poo-pooing it. Exactly. You were advocating still.
Exactly, exactly. So yes, so there are there are a few there are Myos here.
Okay.
I am professionally consulting at a practice that's in Vancouver, Washington, and in Portland, because they've had training, but the owner wants to give them as much support as possible. So I'm doing that right now. And there are some RDHs that are in the area that are working. And honestly, a lot of people are reaching out to me and like talking to me and asking for some consulting or advice. And I love mentoring. So it's super fun. So I think now it feels like there's enough in the area to cover the kids.
That's good.
But it's all, honestly, it's about catching them as early and helping the parents understand it. So they're probably still a lot not getting the services here.
Yeah, definitely.
Would you say most are SLPs, most are dental hygienists? Where do you see the balance?
I think it started mostly as SLPs, but I'm seeing it take a swing to the RDHs.
Okay.
Mhm.
Interesting.
And in that respect, I feel like in this area, they're very respectful and want to understand when it's out of their realm that they need the SLPs to be involved, and kind of like when to do that referral and not at all, don't even start with them and send them to the SLPs. That's one of the things I'm talking to them about, the ones that I'm mentoring. And they seem like, yes, 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 that makes complete sense.
Absolutely. Yeah. The mentoring is, passing along that torch, and now it doesn't have to be just you anymore.
Right, right.
That's nice.
Yes. At this point, I'm dabbling a little, like I'm still seeing clients, but not as much as I used to in my practice. So, because of all the other things that I'm doing.
Yes.
Yes.
I understand that too very well. You have to have many hats.
Yes, I know y'all do. Yeah. Yes.
When it comes to, as you mentioned, like trying to get to them younger, a lot of the times they or the parents really don't even know there's something to be looking for. And I feel like your books could be something that kind of helps to educate the parent when they don't really know, like my kid's tongue should be where, or it's not okay that my child's mouth is open, even though maybe the pediatrician said, don't worry about it, or those kinds of things. So are you trying or thinking about how you can get these books to not just the patient, but to the general population?
Yes, I absolutely am. Because I totally agree. In the beginning of the books, the preface and the prerequisite, I wrote that in hopes of getting these just to the general public. And as anybody that's ready, because as y'all know, and we know, it's like so many children are affected, and they mouth breathing just seems like it's a normal thing. Snoring things seems like it's normal. No, 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 no.
Right.
And so, yes, I do want to get these to the parents.
Yeah.
I to the kids, to the parents, to the general population. Absolutely.
Yeah,
absolutely.
It could be so powerful, because as much as it's a great tool for those going through the myofunctional therapy, getting to the parents that don't even know there is something to be looking for can be really helpful.
Yes, yes. And I'm working on how the best way to get them out there for that. It's kind of, it's very, very backwards in the way that this came to be, I think, in the sense of like, I instinctively knew they had to happen.
Okay.
What I was going to do with it afterwards was like, I kind of did it backwards. I didn't know. I just was like compelled to make them happen. And then I was like, I'll figure the rest of it out. Which is not maybe the
best way to handle it. I get it. I'm right there with you.
Yeah.
That is, yeah, it's true. Where in your mind, where do you see these books being the most proactive to help with the early intervention? I feel like, especially with the dentist, they may not see them till a little bit later. Is it the teacher? Is it the pediatrician? Who's the right person?
Yes. I'm thinking that the pediatric dentists that are airway centric or airway focused, I think that I know from experience, like that a colleague has like had them, she had them in her office and she walked in, she was running late and they were just sitting in the treatment room and she walked in and it was like the parents had been reading it. And so this actually is an orthodontist who's airway centric. And so she said, she walked in and she was going to explain to the parents of this younger child what needed to happen and why. And the with the mouth breathing and the growth and development. And the mom's like, yeah, we just read the books. Okay, so tell us what we need to do. What? And so she's like, oh my gosh, Tricia, you just made the education of the parents so much easier for me. And then we just went right into what treatment needed to look like. And I'm like, yes. So I feel like pediatric dentists would be a great source to pass these out. I feel like that you're right with the pediatricians.
Right.
Really think that that's an area I would like to address and go forward with.
Yeah.
ENTs.
Yeah. Yeah. Trying to think of all those people you might see early on in development or as you're growing.
Right. I think that pediatrician can be so powerful because even if you're not reaching the actual pediatrician, but you say, hey, I want to give you these books to help fill your waiting room with some educational stuff, and at least you're getting to the parent.
Exactly. And there's a chiropractor that I used to work with a lot with the kids, and they have them in their waiting rooms, and they're just like, oh my gosh, this is just amazing. So that's good. Yes, it's like, and honestly, I think the last person that purchased my books was a social worker.
Okay.
Like that works with children, and she's trauma focused.
Okay.
And I was like, okay, I see that.
Yeah.
Not one I had thought about, but I totally see that.
Yeah.
So I was pretty excited about that. So yes, I agree with you. As much as these can be a tool in the therapy room, they should not stop there.
Right.
They really shouldn't.
Right. Exactly. I think
And they were really meant as a homework assignment to make the parent-child interaction better, carry over better. That's how I used them in my practice.
Yeah, definitely.
Did you utilize them as a tool in and of itself or in conjunction with something else? So if you were working on tongue placement, are you then introducing that book at the same time or before, during, after?
Yeah, great question. Yes.
Okay.
Yes, all about that because, I'm trying to, there's not one way to do this with each kid. Everybody, there's no textbook here. Although we try, we need them, but there's just no textbook answer. And so constantly throwing this at the kids and with other pieces. And one of the main things I liked to do with the children, my practice, or I still do, is let them know that the reason why they're here to see me is not because they have something wrong with them.
Okay. Yeah.
And so I would always talk about, let's get your brain to talk to your tongue. Let's get your your eyes to talk to see your tongue, just kind of piecemealing the body in a sense and giving them control that they can do something. And so that's also my intent with the books is it's like, yes, you have this body part and it's very important to use it. And you actually can do this.
Right.
You actually can make it better. You actually have a sense of control and then trying to make it enjoyable.
Oh, so true.
Yeah, it's motivating. I love the
Yes.
carryover piece to get it into home because, sometimes we say so much in the session, but without that carryover. So being able to read it as a bedtime story or, those things are so helpful.
Yes, 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 yes. And my recent interaction with the books, I was asked to do help with an eval in the school district because she had issues. She had a syndrome that it impacted. Open bite was one of the parts of her syndrome, and she was very apprehensive that I was there in her little speech room with the speech teacher, and she was kind of looking at me. And so I had the books, and it was not the intent to start with this, but they were just there because the SLP had bought them. And so I was like, oh. So I put them in front of her. I was like, do you want to look at one of these? So she picked Miss Tongue first. And so she was reading through it. And she was like, okay. And then we get to the end and she sees my picture. And she looks at me like, yeah, did you write? And I was like, yeah. And then she was like, kind of intrigued. And she was like, and then the others, which she pointed to the lips. And so we started reading that one. And I kid y'all not, like the lips automatically, without even saying anything to her, started closing. And it was like, this is like seeing my actual printed books in action rather than the drawings and the printed out ones on paper that I've used and the ones where the kids were drawing their pictures and all that. It was so cool. And then then she picked up the nose and you could see her just like just trying. And then she wanted to go back to the Miss Tongue and she was like, she just started pointing at her mouth and she's like, pillow. I'm like, right.
Oh.
And so anyway, it
what
was
a nice moment for you seeing it all like just come together.
right.
Very nice, very nice. What does some of your future plans look like? Are there more books to come?
Yes, there are. So I'm working on currently getting the illustrations done for the Mr. Thumb book.
Okay.
Very nice.
And so toying with the title, Mr. Thumb Goes It Alone.
Okay.
Very cute.
Because his friends are the tongue and the lips or the mouth.
Okay.
So
very cute.
Yeah, so that's that one. It's been written and just waiting on the illustration. So that one. And I'm also the one about I'm wanting to explain, like, so Miss Tongue Learns to Dance is another one that just teaches like the movements, and I can show y'all some pictures of that. But it's really about the frenectomy, pre and post frenectomy.
Oh, very nice.
And so I'm also doing a part like why I'm toying around with this one, why Mr. Nose can't breathe.
Okay, yeah.
Why that Miss Tongue can't dance.
Right.
Why the lips can't stay together. So to try to get to the parents and the kids to explain why it's so important for Miss Tongue to rest or for Mr. Nose to breathe so those are the in the works ones, trying to figure out the right wording to explain it to this age group.
Right, that's true.
So true. It's so true because you want them to understand what you're saying, but there's certain concepts you can't dumb down or a good word for that, but you can't bring it to a pediatric understanding. So try and find that language.
Exactly. And then I also have the nasal breathing, the lips and the tongue and the jaw actually for the school aged. And that is together in it's not published yet. It's together with my articulation, like how you use the resting postures for articulation skills.
Okay,
Yeah.
And so that is in the works. And also I've been working on a project, a book project with an orthodontist in town. And so from the oral function and the structure,
Okay.
so that is close to being finished.
Wow.
So there's that. And about to next week do a collaborative course,
Okay.
possibly. So I'm gonna leave it at that for now.
Yeah, okay.
And yes, just till it's finalized that this is
Okay.
gonna happen. We're talking about it on Tuesday. And it would be in oral myofunctional and speech. The
Okay.
combination, because it's so important, as y'all know,
Mhm.
like for foundations for
Mhm.
clear and crisp speech.
Yep, no one's thinking about it.
Mhm.
So is there any time that you would suggest to a parent that it should be done proactively but versus reactively?
I honestly, I think the minute they notice that the lips are open,
Mhm.
miss the lips coming there.
Got it.
Mhm.
I mean, like, I think it's simple enough. And honestly, I read this is the cutest thing. I read this to a preschool group, toddlers.
Okay.
Okay. And I have this big lip pillow, like
Okay.
this big. And so they were so young, they were like sitting in the caregiver's laps, most of them. Okay.
Okay.
That young, like 14 months is 18, 20, 20, like literally tiny. And for the Mr. Nose, I have a construction hat and then I also have a cape. Okay.
Okay. Okay.
So one of the little boys picked up the cap, put it on his head, picked up the lips pillow, and walked around to each of his classmates with the lips. And I was like, did that just happen?
Right. Oh.
Did that just happen? So my thought is if the parents start reading this to the kids,
Mhm.
whenever they start reading the books,
Mhm.
the pictures are there, they're illustrations I think are cute and engaging.
Right.
And as soon as you can just start about the lips staying together, why not?
Right.
Yes.
We know how young they start to understand language.
Mhm.
Yes.
Mhm.
Yes.
Mhm.
Yep.
Yeah.
So active. And yes, go ahead.
No, I was gonna say, even from a therapist perspective and a mom perspective, like sometimes you say it, but now it's like I'm not just saying it, the book is saying
Yeah,
it.
exactly. Yeah.
Exactly.
Mhm.
Exactly. And I also think they'll know how, like, even if you don't have structurally anything going on, but say your child has a lot of ear infections and colds that are just because, and we know like habitually your mouth breathe because you have to, and then you have to go back. Why, like this would be helpful for that, just for that short amount of time.
Mhm.
That's like, oh, right now your nose is stuffy because you have a cold. And then when it's not stuffy, let's put those lips back together and
Right.
prevent like some habit that forms from a bad cold.
Yes.
Yeah,
Yep.
absolutely. Wonder if you could even tie in like the school nurse, going into classrooms and reading these books to those younger kids.
That is a fantastic idea. I love that.
I love that too. Good job, T.
Yeah.
Yes. Okay. I am, that is on my list
Your
now.
next book is
I mean,
to have
like,
a little thing
yeah.
right for you.
I'm like, anyone that wants to listen to me talk about these, I am all about it. I'm
Yeah.
so obviously passionate, as we all are.
Mhm.
And I feel like that the feedback and just, I mean, I know I'm partial because I wrote them.
Of course.
And I just think that anyone like my husband's in marketing
Okay.
and he was asking me about this and I was like, everyone needs them. And he goes, that's really tough in marketing. How are you supposed to market? How are you supposed to sell this? I was like, I don't know how else to tell you, but everyone
Mhm.
Yep.
can need these.
Yeah.
Yep.
Could need these.
Yeah.
Yep.
So anyway.
And
Yeah.
I feel like even us with Spot Pal, I feel like we focus so much on the people that are already engaged in treatment, engaged in therapy, that to give them the next step or something
Yes.
more. But you don't think about how it would be beneficial to the rest of the population. So if
Mhm.
one child that doesn't get into therapy realizes
Right.
his tongue's in the wrong place and closes his lips because the school nurse read a book to him,
Right.
you're still accomplishing something.
Absolutely.
Exactly.
Mhm.
Exactly.
Mhm.
And along that lines, think about Spot Pal and this.
Yes,
Right.
yep. Well,
Miss Tongue.
I mean,
I need it. That's what I was thinking. You're reading my mind.
right.
Yep.
Yes.
Like
Yep.
it's yes. And in because you can't just choose one thing.
Yes,
Mhm.
agreed.
You can't. You
Right.
know, it's like it's a tool that you add with all the other tools
Mhm.
that are yes. And so yes.
And I
Anyone
think the
can have one.
visualization is great.
It
Like
is.
it's so hard to with the mouth puppet or the tongue
Mhm.
puppet, so
Mhm.
hard to show
Mhm.
Yes.
Mhm.
and for
Yes.
them to understand. Like I
Mhm.
want your tongue to be here, but I don't want to stitch your teeth, but I want you to use that as a guide to move back.
Yeah.
Like, wait, what?
Just look at this picture.
Exactly. Can you see where the pillow is? That's
Yes.
where you're going.
Yeah.
Yep. No.
Yes, that's it. It's
Yeah.
so true. It's so true. It's so true.
Yeah.
And like, different things stand out, I think, with different clients, that you have. And like, I was trying so hard, like to figure out like, okay, the two main things is like you want the entire tongue up there
Yeah.
and you don't want it going forward on the teeth because we know how many times that happens. They get the
Right.
tongue up there and then they're pressing on the teeth, and we've got another habit we have to
Exactly. You're like, I just traded it in.
Right.
Yeah, I don't need, yeah.
Yes.
What is the cost and where would they go to purchase?
Mhm.
Perfect, perfect. So each individual book, I think this one is $14.99.
Okay.
And then the other individual books are like $11.99.
Okay.
And then as a set, you can get it a little bit cheaper, like $29 for these three.
Okay.
And then I also sell in the sense of if you're having the frenectomy,
Mhm.
Miss Tongue Learns to Rest and this together because it's like,
Yeah.
hand in hand.
Yeah.
Yep.
Yeah.
Yep.
Okay.
Absolutely.
So yeah, so they're about $11.99 a piece.
Very nice.
And my website
Okay.
is misstongueandfriends.com. So
Okay.
there you can buy them on the website. And all of these are in ebook form as well. And
Okay.
my thought is, well, two things. It's the international to
Yeah.
make it easier for them, and that's been good.
Mhm.
And then also, I feel like the kids may just want to do it on their own on their little iPads.
Okay.
Yeah.
Yeah.
There. And
Yep. And the illustrations are so great that even if they can't read the words, they can see what's happening.
Yeah.
exactly. And the ebooks are $8.99.
Okay.
Right.
Yes, they are. And the Miss Tongue's Resting Adventures is an ebook only. And Mr. Nose is going to have his own. It's not Resting Adventures, but he has his own little one like that. And the lips have their own like that. What's taking the longest time is getting the illustrations done.
Okay.
Okay.
But
That's the harder part.
That's the hard part. I
Interesting.
imagine it's not easy to pick an illustration that works. Like you have to be like overwhelmed by, okay, I think this one works, but oh, maybe I want to change this or I want to, change
Yes.
this.
Mhm.
Yes, exactly. And so being so intentional like that and just and editing and just yes, just because I just want it to be all inclusive and get to the points that are the typical activities that kids may do at that age, but not, limit it. And so, yeah, so.
Do you only ship directly from your store, your website, or can we have inventory on our site if we want to?
Great question. Thank you for asking that because this is new. Yes, I have an affiliate program now for
Okay.
professionals.
Okay.
So, and that can be found on my website.
Okay.
And also a referral program right now. So if you refer to other people, you get the Miss Tongue's Resting Adventures for free.
Right.
Aw,
Okay.
very nice.
So it's like if you're going to refer to another professional, maybe
Mhm.
that works, or if you want to sell them to your patients, and that's the affiliate program. Yes,
Okay.
those are
Got it.
very new.
Yes.
Got it. I
Exciting.
love it. I mean, I even feel like you said the Miss Tongue Learns to Rest with our spa pal would be
I
fantastic.
know, right? That would
They
be
like
really
came
cute.
together.
Uh-huh.
Really, really, really cute.
Mhm.
Yes.
Goodness.
Aw.
No,
Yeah.
it really was so amazing having you today and
Thank you
being
both.
able to ask those questions and hear
Mhm.
just how this all's come to evolve. I feel like as professionals, we're so cerebral and we're always thinking of like that next thing that can support our patients.
Mhm.
And you are definitely a visionary when it comes to that because of what you've created. And I do think it will make the world of difference moving forward just because Myo's been around for how long and these have just not existed.
Mhm. Mhm.
And it's almost an education to the practitioners as well
Mhm.
Yes.
about, why it's so important because sometimes I feel like they can be our biggest negator. They're the ones that are,
Yes.
counteracting the things that we're saying are happening or what it's
Yes.
causing. And
Mhm.
so I even for them, I'm like, the patient should be reading it to them too.
I agree. That is such a great point.
Yep. Yep.
Mhm.
And especially those that have been practicing for a long time, they're not airway focused at all. And sometimes just very close-minded. So
Yes.
easy way to convey that information, but get your point across, you have it right.
Yes.
Mhm.
Yes. And one of my orthodontist friends was like, for the practitioners like this, she's like, these are so non-confrontational, Tricia.
Mhm.
So non-confrontational.
Yes.
And she and I have a plan to target the ENT and the pediatricians, as we were talking about earlier, in our area.
Yes.
But fingers crossed.
Yes,
Yes.
fingers crossed, definitely. And even do you do oral surgeons too? Who does their phenectomies by you? The oral surgeon? Yeah.
So yes, and in fact, I am one of the oral surgeons. So Dr. Gahary is here. Yes,
Oh, nice.
Gahary is here.
Okay.
And then there's another oral surgeon that I've been in contact with. He and I actually are meeting for coffee again tomorrow. And he, oh my gosh, the Miss Tongue Learns to Dance. He's like, this is not just for the kids, Tricia. This is for the adults. And I like use the helper
Oh my God.
as
So
the
cute.
doctor.
Yeah.
So cute.
Yes. So anyway, and it's just the foundation, but this also is good for jaw and tongue disassociation.
Yes.
Nice.
So the pre and post.
Yeah.
So anyway, but yeah, he's like all over this one. And honestly, he is the one that was like, Tricia, we need to do the one before.
Yeah.
Like, why do you need this?
Right.
And I'm like, oh
Right.
yeah, that's right. Yeah.
Yeah.
Right.
Yes.
So
That's great.
It's great. And not everyone patient fits into the same mold too. So you don't want to say you need to do all of these or some of these. It's got to be based on who you're working with and what their needs are.
yes.
Right.
And I struggled with that in the sense of writing this one.
Okay.
Because I was like, do I do it? Do I not? And then, but the rhyme for the book, literally, I came out of me and I couldn't stop writing it.
Wow.
And I was like, so that's why I didn't let this one out till later or even do the illustrations for it. Because
Okay.
I was actually more nervous about that one because
Okay.
of exactly what you said.
Okay. Makes sense.
Okay.
Makes
Sounds
sense.
like a good one. I'm excited to get our hands on that one.
Good. Good.
Absolutely. Thank you so much for joining us.
Thank you all so
I do
much.
think we'd love to have you back on again when the rest of your books come out.
Yes.
I would
Just
love
talk-
that.
I'm so glad. And
Mhm.
just be able to talk more about it. It's just amazing, a breath of fresh air to talk to someone like you who's doing something like this for our profession. It's really moving our profession forward. And especially that myofunctional therapy side of things where we're just starting to scratch the surface. So if
Yes.
there's anything that can support that to the next level, this is it. And you've created it. So
Oh, thank you. Well, and I appreciate y'all so much for having me on and for helping me spread the word about
Yes.
this. Like, I really just want everyone to be, as we all do,
Yeah.
want them to breathe well, healthy.
Yeah.
And I'm so thankful for y'all for having me on and spreading the word.
Thank you for joining us on this episode of Talk the Talk.
We hope it was enjoyable and educational and further supports you both personally and professionally.
For more information, please check out our Wyo Myo and Myo Minute podcast, as well as our other episodes of Talk the Talk. And don't forget to check out our tongue training appliance, Spot Pal, to help with tongue thrusting, thumb sucking, snoring, TMJ, mouth breathing, and so much more. Visit thespotpal.com.